Hey guys, so today we will be going over atherosclerosis. So what is atherosclerosis? Basically, it's thickening or hardening of the arteries caused by a buildup of plaque in the inner lining of our artery. So you want to go back to anatomy and be like, what is the purpose of your artery, right? So we know that blood flows through our arteries to perfuse the rest of the body, right? Okay, so as you can see in this one, let me grab my highlighter. So if you can see in this one, this is a healthy one. This is a healthy artery right here. And as you can see, blood is able to flow in and out this artery, right? And then we have some little inflammation. So you can see how we don't have as much blood flow coming through as we would if it was healthy. As you can see where it has a stiffening of your artery. So as you can see, all this plaque buildup causes the artery to become stiff, right? So if something doesn't expand, it is stiff, guess what? Blood flow can barely just go through. So as you can see here, that blood flow could be affected here. And then we can get to plaque buildup, which we'll talk about later, but you can see how blood flow could be affected as well. So with atherosclerosis, basically your arteries are not functioning like they should because your arteries have been damaged. So let's dig a little deeper. So what is the pathophysiology of atherosclerosis? So it's basically when fatty plaques develop in your arterial walls, and it basically limits your blood supply to your heart muscle. So why is this something that we want to worry about? Because we know that we need blood in order for the rest of our organs to function. So we want arterial walls to be open, right? So that blood can flow through it without any problems. We don't want it to have fat build up all around it, and then when it's time for the blood to go through, the blood can barely go through. So the biggest takeaway from this slide is that atherosclerosis limits blood supply to the heart muscle. So it also can lead to hypertension, chest pain, and heart failure, which we'll talk about later on. So one of the things you will see about the cardiac section when it comes to our risk factors is a lot of this can be modified. So that's why we want to make sure that we know our risk factors so we can teach our patients how they can modify their lifestyle in order not to have these diseases or lessen the flares of them. All right, so let's talk about some things that the patient themselves can control. So your risk factors are high blood pressure, diabetes, kidney dysfunction, high cholesterol, right? Let's talk about diabetes. So diabetes increase inflammation, they damage our vessel walls, they increase coagulation, and it inhibits fibrolysis. So you kind of want to know when it comes to your risk factors, you want to know actually why it is a risk factor, because when you know why something is a risk factor, you're able to teach your patient. All right, and how about their behavioral changes, right? So diet, right? So when we talk about our cholesterol, if a patient eats food that are high in cholesterol, they eat a lot of fatty food, all that stuff can lead to plaque buildup in their arteries, right? So how about smoking? So nicotine decreases blood flow and causes vasoconstriction while also increasing platelet aggregation. So smoking is a big risk factor that we'll talk about throughout like all the diseases that we'll be going over today. So you want to make sure that you educate your patient about their diet, smoking, alcohol consumption, and physical activity, right? We know that obese patients are at risk for a lot of cardiac disorders. So you want to make sure that you're educating your patients. Some things that they can't control: age, sex, ethnicity, and genetics. But we want to make sure that we're able to teach our patient about the modifiable risk factors. So how is this diagnosed? So we have multiple ways it's diagnosed. So our blood tests which we would get a lipid panel done, and it shows our total cholesterols, our LDLs, our HDLs, and our triglycerides. And then you also can have an EKG, and what they're looking for in the EKG is any changes in their ST segments or in their T waves. And basically they're looking to see if there is obstruction of blood flow, if the patient had a previous heart attack. Those are the things that they're looking for. Also, they can have a stress test done, and the purpose of a stress test is to monitor the heart rate and rhythm during exercise to see if there are any EKG changes. During activity, if the blood flow is reduced, the ST segment will show depression, and the patient will have chest pain. And then as the activity stops, the ST segment will return back to normal. A patient would probably then be ordered a heart cath to assess where the potential blockage is located. So I know y'all like, Dr. Bonnet, we haven't gotten to rhythms yet, but it's just something to know. So like it mentioned that the patient could have a heart cath done, and where they would just go in with a camera into that artery, and then they're able to see the blockage there. So a patient can also have a percutaneous coronary intervention angioplasty as well. So our signs and symptoms, what is our patient going to look like? So our patient is going to be experiencing chest pain. Why would they be experiencing chest pain? From the lack of oxygenation going to that area, right? So chest pain during activity, which is stable angina, is not a medical emergency, but patients need to let their doctors know about their chest pain so that they can do the appropriate test to make sure that it is stable angina. All right, the pain may feel like a heaviness on the chest, and it can progress to unstable angina when the patient will have pain at rest and it's more intense, and it may not be relieved by nitroglycerin. So just with your chest pain, know that with activity, these patients will have chest pain if it's stable angina, but if they have chest pain even while they're at rest, or it gets even worse while they're resting, that it could be unstable angina. So we just don't want the patient to be diagnosing their own chest pain. We want to make sure we let them know, hey, let your provider know what kind of chest pain you're having. Let them know your symptoms, and let them go over your medications and stuff like that. So so definitely chest pain. All right, so shortness of breath. Easily get short of breath during activity because the blood supply is impeded to the heart muscle. So remember, like we said, through your arteries, what's the purpose of your arteries? To carry that oxygenated rich blood, right? So if we have any type of blockage in our artery, expect restricted blood flow. So just like the chest pain, the heart is not getting enough oxygen. So guess what? That's why the chest is hurting. Shortness of breath. Your lungs is not getting enough oxygen-rich blood. So guess what? Now you're short of breath. So your patient may also be very fatigued as well. So those are some signs and symptoms that you just want to pay attention to in your patient. All right, so some nursing interventions for atherosclerosis. We really want to focus on prevention. So we want to make sure that we educate them on our lifestyle modifications, that whole slide for risk factors. We want to make sure that we know the diet that they should be on, that we tell them about smoking, that we tell them about drinking, and even controlling their blood pressure, because with your blood pressure, if you have increased blood pressure in your artery, that leads to damage of that artery. So we want to make sure that patient is controlling their blood pressure, and then we would have the patient education on controlling their blood pressure. So what they eat, you know, stress as well, smoking and alcohol, all those things play a part. And then signs and symptoms of when to seek help. When do a patient need to seek help, especially if they have been diagnosed with stable angina and they take their nitroglycerins and they haven't experienced any relief, that they definitely need to call 911. And any shortness of breath, that they feel like they can't get their breath back even though they have already stopped the activity that started the shortness of breath, we want to make sure that we're educating our patient on when to seek help. So on to the part I know you guys have been waiting for is medication review. So if you put your farm book away, if you put all your farm notes away, this is a reminder to go get it right now. So the medications review: aspirin, Plavix. You need to know why these medications work right here. So with your nitrates, we know that your nitroglycerin is a big one, right? And what is the purpose of nitroglycerin? What is nitroglycerin's job? And it is to dilate the vessels to allow more blood to get into the heart, right? So what do you want to make sure you educate your patient about? So nitroglycerin is taken sublingually, meaning under the tongue. So you want to make sure that your patient knows that it's supposed to be taken under the tongue. All right, or if they have the spray, you spray it under the tongue. So patients may feel dizzy or hot flushing after taking nitro. As the nurse, you will need to assess their blood pressure. Why? Because this medicine can cause hypotension. So if the pain is not relieved in 5 minutes, they can take another dose of the nitro. If it's not relieved in another 5 minutes, they can take the third dose. The patient is not to take any more than 3 doses of nitroglycerin. If the pain is not relieved with the third dose of nitro, they need to call 911. So you want to make sure that you're educating your patients on their medications, okay? All right, so you want to make sure that they're taking their cholesterol lowering medications, right? So these are your statins, right? You want to educate the patient that this medication is not in replace of them eating whatever they want. So a lot of patients think like, oh, if I'm taking this cholesterol pill, so guess what? I can eat all the cholesterol that I want to eat because this pill is going to cover it. No, we want to make sure that you're telling your patient they still need to eat right and they still need to be exercising, right? So beta blockers. So how can beta blockers help us with our arteries? So beta blockers, which is our OLOL, right? They lower your heart rate and your blood pressure, which reduces the workload of the heart, right? This will decrease the episodes of chest pain. All right, and so our ACE inhibitors, we know that the ACE inhibitors cause vasodilation, which lowers our blood pressure, which allows the heart to not work as hard. All right, so you just want to make sure that you know your medication, and if there are some prevalent, some prominent side effects that come with these medications, that you should be familiar with them, because you want to be able to teach your patient. So if your patient says, hey, the doctor prescribed me metoprolol, what is this? You want to be able to educate your patient on what this medication is. So remember, as a nurse, your job is not to just pass the medication, it's to be able to educate the patient on the medication. All right, so now we're moving on to peripheral artery disease and peripheral venous disease. So we're going to be doing side-by-side comparison of them both. All right, so what is the pathophysiology of peripheral artery disease? So number one, peripheral artery. This is the artery. So make sure you know the job of an artery. So if you need to go brush up on your anatomy, I have a artery, not an artery, I have a video of the assessment, just the assessment and the anatomy of the heart. So if you need to go back over that, I suggest you do. But with PAD, there is a narrowing or inclusion of your peripheral arteries that mainly affect the lower extremities, but it can affect any way that your arterial